A recent survey from the University of Michigan, 1 in 4 parents say their teens are consuming caffeine every day. I feel like it's starting younger now.
I do too.
Let's bring in Dr. Matthew Knight, our dear friend. He is the president of Knight Dermatology Institute. Great to have you.
Good morning, everybody.
Good to see you. Good to see you.
Thanks.
Happy Friday to you.
Yes.
Okay, so it is interesting because when I was a kid, caffeine wasn't really a big thing, right?
That's right.
Every occasionally you'd have a Coke or a Pepsi or whatever. But now kids are drinking coffee at a younger age, and they're trying all these fancy drinks.
They sure are.
It's a whole different world.
And the caffeine content is going way up.
Yeah.
I mean, caffeine is a drug that's present all over the place and affects our central nervous system and our heart, so it can increase our blood pressure and make our heart squeeze differently. And it really is everywhere. And I thought it'd be interesting to go through the common caffeine content of things like coffee. And I'm sorry to talk in milligrams here.
No, you're good.
But
You're
coffee
good.
has like 100 milligrams of caffeine in it. A Coke or a soda like this.
We can come back to Dr. Knight here. He's got some props he wants to show us.
Like
Here we go.
50 milligrams, like half a coffee in here, or tea, like black tea, is like 50 milligrams of caffeine. So like half a coffee. Chocolate has caffeine, like 10 or so. But the problem are these energy drinks.
Okay.
And I see kids slamming these things all the time.
Yes.
Especially after school, like after 3 o'clock when they need to start winding down for bedtime. These energy drinks can have 150 to 300 milligrams of caffeine in them. So like 3 coffee. And cold brew, because the way that the beans sit in the water for 12 to 24 hours, can be 300 to 400 milligrams of caffeine. So 3 to 4 times a normal cup of coffee. And the thing I worry about a lot are these energy drinks. Some of them are fine, but like these pre-workout powders that these kids are doing before they go to practice can be 400 milligrams plus of caffeine, and this is where kids get into trouble.
Wow.
Like you mentioned, the American Academy of Pediatrics recommends no more than 100 milligrams for children during the day. For adults, it's like 400.
So what does 100 milligrams mean? Like, what does 100 milligrams look like?
Yeah, they get 1 cup of coffee.
One
or they
cup,
get
okay.
2 sodas, which I don't recommend for other reasons, but they get 2 sodas. But just one of these energy drinks sometimes can already put them over the total limit for a day. So just one energy drink can have more than 100 milligrams, and I know kids that are drinking 2 or 3 of these a day.
All right, so Doc, let's talk about why kids are drinking energy drinks, right? And let's get to the nitty-gritty of the problem. And I'm guessing it's because they're a lot of times up late on their phone, scrolling, not getting nearly enough sleep.
Yeah, I think there's a lot of pressure on kids for performance these days too. Athletic performance. I mean, back when we were kids, you just kind of hit the ball around. Now they've got coaches and they're taking it super seriously. So these pre-workout powders are really popular, sometimes late at night. And like you mentioned, that can create downstream problems, right? Kids need to sleep. They need to be able to focus. And if you have a kid that is prone to anxiety or other mood disorders, it can cause panic attacks and ADHD and other things. And so it's really a different world. And the problem is there's some really well-publicized accounts of kids that got into serious trouble with this stuff. There was one poor kid, I think in South Carolina, who had a coffee and then had one of these energy drinks and some of this pre-workout stuff, and ended up having cardiac arrest in the emergency room. And would you believe that children going to ERs with caffeine-related stuff is up 100% over the last 2 to 3 years, including calls to poison control centers.
Wow.
So you can get in trouble with seizures because of the neural stuff. You can have muscle breakdown, something called rhabdo. You can even have psychotic episodes in kids that consume too much caffeine. And again, what happens is they're not just having a cup of coffee. They're taking coffee, then they're having after school an energy drink, and then before they go to practice, they're having workout powder. And so they're getting upwards of 800-900 milligrams of caffeine in a day, where the max for a kid is 100. And so they're massively overdoing it.
Can you become addicted to caffeine?
Well, okay, I'm a doctor, so I am addicted to caffeine, I think. But you know, most of us are aware of the normal type of addiction, right? Where you feel crabby and you have a headache and you don't feel great until you have that first cup of coffee in the morning. That's pretty common. But it's not like a physiologic addiction like most street drugs that we're aware of. But I mean, there's a lot of kids out there doing a lot of these energy drinks.
Yeah.
A lot of times after school too.
And I think too that we're finding more and more that sometimes we don't realize the harmful effects of things until it's too late, right? And then all of a sudden we're like, why are we seeing a spike in this or that? Yeah. And then all of a sudden we go back and we say, oh.
Well, it's like any drug, right?
Yeah.
I mean, any drug is about dose. So if you have a couple pieces of chocolate that's got 30 milligrams of caffeine in it, it's not a big deal, or tea, it's fine. But if you're slamming coffee and then an energy drink and then pre-workout powder, you're like 6, 7 10 times X the normal amount you should be having. And the one thing I wanted to mention is that parents nowadays need to be aware of the signs and symptoms of caffeine overdose. So if your child is having severe nausea, or they're shaking, or they have extreme anxiety or psychosis, or they're delusional, they don't know where they are, that can be a sign or symptom of caffeine overdose, and that's something you want to take very, very seriously.
Wow. Do you like this idea of 19 or older for caffeine? Do you think it'll happen?
I mean, I think it's probably not realistic. I know that the caffeine is out there, and the problem is that the caffeine content just keeps getting bigger and bigger. You know, these cold brew beverages, which are delicious, have a lot of caffeine because the bean sits in there for so long.
Yeah.
And so it's really popular. I don't think we're ever going to claw this back, but I think parents need to be aware, and especially with this workout powder and caffeine pills, they need to be monitoring what their kids are doing, especially before games and things like that.
All right, great advice. Great to have you with us. Fascinating discussion for sure. Thank you so much.
It's a big topic.
Dr. Matthew Knight. He is the president and a doc, the big doc at the Knight Dermatology Institute. Great to have him as always.
Have a great weekend.
Thanks so much, Doctor.